Hello everyone, my name is Liu Ruoshi. I'm from the Department of Traditional Chinese Medicine, the first affiliated hospital of China Medical University. I'm the teacher of this class. Today, I'm going to explain the bladder meridian of food, 太阳, in the 12 meridians. This class will explain the related contents of the bladder meridian of food, 太阳, from 3 aspects. Now, let's start our class. First of all, let's start to learn the course of the meridian. The straight portion of the meridian enters and communicates with the brain from the vortex. It comes out and bifurcates to descend along the posterior aspect of the neck, and then downward along the middle aspect of scapular region, and parallel to the vertebral column. It reaches the lumbar region, where it enters the body cavity via the perivertebral muscle to connect with the kidney and join its pertaining organ, the urinary bladder. The branch of the lumbar region descends through the posterior aspect of the skin and ends in the popliteal fossa. The branch from the posterior aspect of the neck runs straight downwards along the medial border of the scapula, passes through the gluteal region and downward along the lateral aspect of the skin to meet preceding branch ascending from the lumbar region in the popliteal fossa. Then descend through the gastrocnemius muscle to the posterior aspect of the external malleolus. Then runs along the tuberosity of the external metatarsal bone and reaches the lateral side of the tip of the little toe. The course of the meridian has been learned. Next, let's start to learn the principal indication of the bladder meridian of food, 太阳. Diseases of head, neck, eye, lumbar region, and the lower extremities, mental diseases. The back shoe points along the first lateral line, and the corresponding points parallel to them on the second lateral line over the back are used to treat diseases of their relevant joints, organs, and tissues respectively. The first 2 aspects of the bladder meridian of food, 太阳, have been studied. Now, let's start to learn the third aspect, the points of bladder meridian. This meridian appears at 镜明 and ends at 至阴. Bilaterally, it's consisting of 67 acupuncture points. In these knowledge points, we are going to learn 6 acupoints commonly used. The first point is 镜明. The acupoint is located in the depression superior to the inner cancers. The location of this acupoint contains angular artery and vein. Distribution of the supratrochlear and infratrochlear nerves. Deeper the calcaneus nerve, and the ophthalmic nerve. The acupoint can cure redness, swelling, and pain of eyes, lacrimation, blurring of vision, vertigo, myopia, night blackness, color blindness, acute lumbar pain, sciatica, palpitation. The operation method of this acupoint is that have a patient close his eyes. With left hand, gently push the eyeball towards the lateral side. With right hand, slowly insert needle perpendicular 0.5 to 1 cun along the orbital wall. It is not advisable to rotate or left and thrust the needle. To avoid bleeding, press the puncture rate set momentarily after withdrawing the needle. Masturbation is contraindicated. The second point is 传足. The acupoint is located in the depression on the middle end of eyebrow, on the supraorbital notch. The location of this acupoint contains frontal artery and vein. Distributions of the medial branch of the frontal nerve. The acupoint can cure headache, pain in supraorbit region, twisting of eyelid, blyssolatosis, deviation of mouth and eye, blurring of vision, redness, swelling and pain of eye, hiccup. The operation method of this acupoint is that subcutaneous or oblique insertion 0.5 to 0.8 cun. Masturbation is contraindicated. The third point is 大柱. The acupoint is located 1.5 cun lateral to the lower border of the spinous process of the first thoracic vertebra. The location of this acupoint contains the medial continuous branch of the posterior branch of the intercostal artery and vein. The distributions of the medial cutaneous branch of the posterior ramus of the first thoracic nerve, deeper, its lateral branch. The acupoint can cure cough, neck stiffness, pain in shoulder and back. The operation method of this acupoint is that oblique insertion 0.5 to 0.8 cun. The points on the back of this meridian are not available to puncture deeply in order to avoid injuring important internal organs. The fourth point is 肺腧. The acupoint is located 1.5 cun lateral to the lower border of the spinous process of the third thoracic vertebra. The location of this acupoint contains vasculature is same as 大柱 mentioned above. The distribution of the mental cutaneous branch of the posterior rami of the third and fourth thoracic nerves. Deeper, they are lateral branch. The acupoint can cure cough, asthma, hemoptysis, hectic fever, night sweating, all types of deficiency of yin disease. The operation method of this acupoint is that oblique insertion 0.5 to 0.8 寸. The fifth point is 尾中. The acupoint is located middle point of the transverse crease of the popliteal fossa, between the tendons of biceps femoris and the semitendinous. The location of this acupoint contains femoral popliteal vein, deeper, the popliteal artery, tibial nerve. The acupoint can cure pain of back and lumbar, pain, numbness, and weakness of lower extremities, abdominal pain, acute vomiting and diarrhea, anuresis, dysuria, erysipelas. The operation method of this acupoint is that perpendicular insertion 1 to 1.5 寸, or break the popliteal vein with 3-edged needle to cause bleeding. The sixth point is 至阴. The acupoint is located on the lateral side of the end of the small toe, 0.1 寸 from the corner of the nail. The location of this acupoint contains the arterial network, the distribution of plantar digital proprio nerve, the lateral dorsal calcaneus nerve of the foot. The acupoint can cure the malposition of fetus, difficult labor, headache, eye pain, nasal congestion, epistaxis. The operation method of this acupoint is that superficial insertion 0.1 寸. Use masturbation for malposition of fetus. Now, the content of the bladder meridian of foot 太阳 is finished. Thank you for watching.